So this patient has had previous treatments with what appears to be sclerotherapy on the inside of both her legs, and probably down in this area, but she has this recurrence of this large dilated varicose vein. I call it the Braille vein because you don't have to actually look, you can just run your fingers over it and it says varicose vein. So unfortunately, we have patients who come in and have been treated before and they have recurrences, and their recurrences are always more difficult to treat. So she has what's called a cephalid extension. That's to say this vein continues up her thigh, and where you're seeing the red here, this actually starts way up here, and this is probably why it came back, is because this was never fixed. So,
Ow, that hurts.
sorry, this was never fixed. Also, when patients have varicose veins, they have very tender legs. So that's one of the symptoms that patients know. Seriously, patients when they go to get their nails done tell the girls, don't massage my legs. So she has this cephalid extension. Then we get down to her sacropopliteal junction. We have this one segment here, and then it kind of just goes berserk and pops out. So I've got this very short little segment to work with here, and we're going to see if we can get a laser up through here and continue it up through this cephalid extension. We might not be able to. I might be able only to access it a little higher here, so you can kind of see how this vein looks a little tortuous here. That's our left short saphenous vein, sacropopliteal junction. So this is like making a custom tailored suit for our patients, because the easy suit was already bought and used, and now, so we're going to, sometimes we start these patients and we don't actually know where we're going. So I think I should be able to get into it without any problem right here. And hopefully there's no blockages. We have to run a little wire up the vein, and sometimes we go, oops, won't go any farther.
Ow.
Oh, it's really sensitive.
It
Do you think
is,
it's
that
coming from
hurts.
these veins?
I don't know, it's right in here, wherever you were, right in there.
I found the sweet spot.
Yeah, you did.
Okay, so we'll be gentler too. So what we're going to do is we're going to access the vein right about here. I may need to access a little bit higher, and we're going to see if we can go up to that cephalid extension. And we'll see what this looks like after our treatment today. But she's obviously in a lot of pain. This is very, very tender. And I'm afraid to even look at it.